Randomized controlled trials are trials that involve two groups where the researcher has no control over which group the patients or the recruited study participants will be placed in. It is truly randomly allocated. The choice of randomization could be done with the flip of a coin or with computerized algorithms or by having random lots and envelopes. But there are different kinds of randomization that can be used as well. So the most common type of randomization apart from simple randomization is block randomization, where groups of participants who are relatively homogeneous are randomly allocated to the two groups. So the next type of a randomized control study is the randomized crossover trial. In this category, the group 1 patients and group 2 patients are randomly allocated as usual. But midway through the study, the patients are removed from the study. In other words, the treatment is stopped and a 4 to 6 week period of washout is given. After 6 weeks, the treatment is switched between the groups and re-administered to the patients. When you do a crossover trial, you need to do a paired t-test and or a repeated measures ANOVA if it involves more than 3 groups. So that is the randomized crossover trial. Next we shall look about the randomized split mouth trials. A split mouth trial is one in which a single patient becomes two groups, that is either the right side tooth or the left side tooth, right side arm of the left side arm, but within the patient we have the two groups. Again a paired t-test is done and this ensures minimal amount of bias. This would be one of the strongest study designs to have to conduct good clinical research. So the next thing we are going to look about is the randomized double-blinded trials. So blinding is different from randomization. Randomization only determines the allocation of the patient to the groups, whereas blinding talks about whether the operator or the researcher or the doctor who's going to treat the patient is aware of the treatment provided or to which group the patient belongs to. And blinding could be single blinding, double blinding, and triple blinding. Single blinded studies are ones in which the patient is not aware of the treatment they receive or to which group they belong. But in a double blinded study, after the groups are allocated, the patients are given treatment A and treatment B, and the operator who gives the treatment will obviously know what kind of treatment they gave to the patient. But however, after the treatment is given, during the observation period, a third observer will collectively see the patients of both the groups and would do the clinical parameters like how healthy they are and so on. And the group IDs will be revealed to the operator only during statistical analysis. But a triple blinded study goes one step further in that the operator, the patient, and the statistician is blinded. This way, there is every chance of bias in the research is avoided and it improves the validity of the study. So the next thing we need to see is about the consort statement. The consort statement is a list of 25 parameters or points that need to be checked in a randomized control trial to check the validity of the study. A randomized control trial that fulfills all the consort criteria is considered as a sound study trial and can be used for clinical practice, or the results of such a trial can be used for clinical practice.